screen for cancer. Maybe just a very brief introduction to sort of methods available for cancer treatments. Should the patient actually be diagnosed with such a condition? So I'm sure everyone here knows about cancer, and I think that's quite commonly just the word itself strikes fear in people's hearts, minds. Who here perhaps already has a family member or a friend who has been diagnosed with cancer? To at least half. So it's not surprising because cancer is quite common. Right? In the Philippines, do you know roughly what the likelihood of a person developing cancer in his or her lifetime is expected to be? Does anyone know? 1 in a million? Who thinks that?
1 in 100.
1 in 100? Who agrees? Or maybe you think it's 1 in 10,000? Anyone? Just give a number. 1 in
10.
1 in 10? Yeah.
10%.
10. Are you googling this now? Okay, yeah. So it's actually 1 in 5. Yeah. Does it surprise you?
20%.
Correct. So 1 in 5 people in the Philippines, and actually worldwide, is expected to develop cancer in his or her lifetime. So is that common? First of all, what is cancer? Even until now, I still get questions from patients asking me whether this is a kind of infection. So cancer in a nutshell is really a condition that occurs when our normal cells develop this ability to divide in an abnormal way. And this abnormal way really is unexplained. Therefore, the cancer cells even have the ability to attack surrounding normal healthy organs and tissues. They even develop the ability to encroach into our blood vessels. Whereupon, as you can imagine, has the ability to spread to far away parts of our body. Clearly, this is not an infection. This is a very distinct condition, sometimes related to infection as a precipitant, as a possible cause, but in itself is not an infection. So it's common, and it arises really mostly at age, but there are many different risk factors. Factors that increase the risk of this condition of cancer. Then lies the question of how we can prevent it. We know what increases the risk, then we can figure out how to lessen those risks and prevent cancer. It is quite well known that perhaps 1 in 3 cancers can actually be prevented just by some very simple changes in our diet, lifestyle. I have thought a very opportune time to be eating lunch and then talking about changes to our diet, but generally speaking, we know that certain food items, especially the fruits, vegetables, anything that gives us fiber are recommended, lowering the risk of developing colorectal cancer. But there are certain food items like processed foods, like processed foods like say red meat. This actually increase the risk of colorectal cancer. Some of you may even have read in the news some years ago now about how red meat has been categorized by the World Health Organization as being potentially carcinogenic, possibly cancer causing. So we lessen our intake of these items. Red meats, processed foods like bacon, sausages, then we can potentially lower the risk of colorectal cancer. One is probably very well known already, smoking and alcohol as major risk factors. Smoking for oral cavity cancers, smoking for lung cancers. So the right thing to do, of course, is to stop smoking altogether. Alcohol, many people know about it as a risk factor for liver cancer, but even before that occurs for liver cirrhosis. I'm not sure whether some of you are aware that a sedentary lifestyle, unfortunately many of us are adopting, that then leads to obesity in some major risk factors for breast cancer and colorectal cancer. So maintaining a healthy weight, exercising regularly. Then there are also factors like infections I was talking about. And cancer is not an infection, but cancer may be linked to infections. And oftentimes these are sexually transmitted infections. Say, for example, sort of human papillomavirus, HPV. It's actually a sexually transmitted infection and is strongly linked to women developing cervical cancer. By the way, it's third most common cancer in this country. Third most common cancer. And so we know that the virus being sexually transmitted increases the risk of cervical cancer occurring. Then taking the relevant precautions, say using barrier methods during intercourse, can help to prevent the spread of this virus, and therefore greatly lessen the risk of cervical cancer. Then we probably heard about even vaccinations against HPV, a further preventive measure. Then we heard of hepatitis B, C viruses. These viruses can be transmitted sexually, and if someone is infected, they may be at risk of liver cirrhosis, which in turn incurs the risk of liver cancer development. There are many examples of infections that actually heighten the risk of cancer occurring. And therefore, by taking precautions against these infections, it's a means of cancer prevention. So then there's screening. Screening is a form of, it's a way that we detect a condition where there's no symptoms. But screening can also help as far as cancer prevention is concerned. We're able to screen for various cancers, colorectal cancer, which by the way is the second most common cancer in men and in women in this country. So screening for colorectal cancer can help to detect cancer early before any symptoms, so that we can initiate treatment early where the chance for cure is much higher. The screening for colorectal cancer can help to detect polyps, which are precancerous. And the polyp that are detected, we can remove the polyp and prevent it from developing into cancer in the future. So screening therefore has a dual purpose, early detection but prevention as well. And the same is true for cervical cancer, breast cancer screening. You can even screen for lung cancer in the appropriate population. And lung cancer, by the way, is the #1 cancer in men in the Philippines. And of course, breast cancer is the #1 in women, actually also over. So you can screen for these cancers as means of early detection and also cancer prevention. Then of course, if cancer is diagnosed, there are a lot of treatments available. Sometimes we render treatment for the purpose of cure. Sometimes we render treatment for the purpose of control. It's important that we understand that cancer diagnosis is in itself not a death sentence. When we identify a patient with cancer, we need to determine how far the cancer has gone. Has it affected the main organ? Has it affected surroundings? Has it gone far? Has it metastasized? How fit is the patient? So we have to identify the cancer and determine how fit the patient is, and then apply the treatments, which can include surgery, medicines like chemotherapy, targeted therapy, immunotherapy, where in a nutshell, chemo is almost like a poison that prevents the cancer from dividing in the time of treatment. Where targeted therapy is a form of medication pinpointing certain molecules which we know triggers the cancer's growth and spread. So by pinpointing and suppressing these molecules, we suppress the cancer. In immunotherapy, where we use medication to trigger the immune system to help attack against the cancer. And there are also methods of radiotherapy. Nowadays, we need advanced radiotherapy methods. Some of you may have even heard about photon radiation, which is more directed towards where the cancer is and therefore may be effective but yet less collateral damage. So these are various treatments, and quite often we really need to amalgamate treatment amongst different doctors. I specialize in using medicines, so chemotherapy, targeted therapy, immunotherapy is my specialty. But I can't work alone in treating patients. I need to actually coordinate the patient's care. Say a surgeon operates on the method operated. radiotherapy specialist who directs radiation to the affected part of the body. And oftentimes with the radiologists who read images to tell me how far the cancer may or may not expand. To look at the tissue to identify not just the source of the cancer but the genetic changes that may have occurred. It then allows us to offer targeted therapy. We can imagine it's a very complex situation that requires coordinated care in order to deliver the best outcome for patients. So I can illustrate what I talked about with an example of a patient who I met some years ago in her 60s when she was first diagnosed. She had bleeding in the stool. Bleeding in the stool, saw the doctor, and the doctor rightly decided that she would need investigations where she had a colonoscopy identifying a cancer in the colon. Colonoscopy, a biopsy is confirmed the cancer, whereupon she had a scan. The scan unfortunately showed that the cancer having started in the colon had metastasized and spread to her liver. So then she saw me to ask for an opinion as to how this would be treated. She was very adamant at the start, not even sought any medical opinion, but really at the behest of the family, that she actually saw any doctors, much less the oncologist and herself. But I think it stemmed from a lack of understanding because she felt that cancer equated with death. That no treatment was possible, no treatment was meaningful. But I explained to her that in fact, whilst the cancer is in its fourth stage, she was quite unique in the sense that her cancer had originated from the colon, but somehow spread only to one particular part of the liver. So whilst technically this was advanced metastatic disease, she was unique in that she could undergo aggressive treatment for the purpose of curing. So she had her conceptions about what cancer is and what the outcomes would be like. She felt that this was invariably fatal. So it was a surprise to her that I told her that I was going to treat her the intention to cure. And eventually she went for treatment. She had chemotherapy. She responded well. The tumor reduced in size, not just in the colon, but in the liver. And because she was quite a fit 60-plus-year-old lady, she went for surgery. Surgery to remove the tumor in the colon. Surgery to remove the tumor in the liver. And essentially we remove all that we can see. And with chemotherapy, we have eradicated all that we cannot see. At least that was the intent. And of course, with time, this is some years now, like since I first saw her, she continues to see me well. And with time, I could tell her that the likelihood of cure is higher now. In fact, statistically speaking, even for a fourth stage colon cancer, aggressive methods like this achieve cure in about 40% of patients, which is a far cry from what we would normally do, less than 10%. So this illustrates several things. Number one, that there are, even at this point in time, often misconceptions about cancer, what it is, what we can do for it. People often think that it's fatal, but it's not. But just as importantly, even if it's diagnosed, you need to coordinate care. You need a lot of people involved. It was just not me giving her chemotherapy. I had to send her to the appropriate surgeon. And there are surgeons that specialize in liver surgery, surgeons that specialize in colon surgery, so on and so forth. So this is something that is useful, food for thought. Perhaps some of you have already seen friends, relatives who have gone through such processes, or maybe not, because they